And get started.
Yes, good morning, everybody. There's certainly a lot happening in the world, and we appreciate you and your time this morning. Again, good morning and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Northeast Georgia region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan. And I want to thank you again for attending this morning. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation in your region, and your active participation is encouraged. When asking a question or making a comment during these times, please use the raise hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is the comment bubble icon. Our team member Jaquita will be monitoring the hand raises and chat box during the entire workshop. The 2050 Rural and Human Services Transportation Plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors, and the plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. Today, we're going to run through the following topics. I will provide a brief introduction and provide some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in Northeast Georgia. After, Baird Breen from Cambridge Systematics will walk us through the region's transit needs, and then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We will also have a couple question and discussion points throughout the workshop today. So what exactly is rural and human service transportation? Not many people may be familiar with the terms. Rural and Human Service Transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to update the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from the first plan to identify projects, programs, and policies to meet current and future demands and provide enhancements to RHST services across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation, or NEMT. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency system operates independently using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to that plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. This RHST Plan 2.0 outlined coordination activities among the rural public and human services transportation providers across the state to achieve improved service delivery for the state's public transportation and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update to the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You can see we've wrapped up our vision and goals, which I will discuss on the next slide. They're heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get your input from your region to help us understand the needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach events. Those with the pink circle indicate the technical advisory group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, also includes representatives from regional commissions, the statewide Independent Living Council of Georgia, and other stakeholders identified during the stakeholder engagement process. I'm pleased to see a few of them attending the workshop this morning. We are engaging stakeholders and the public in each of the 12 regions in Georgia through these regional workshops. We are also conducting a statewide survey for RHST providers and a separate survey for writers, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to assess the status of the RHST plan update and identify key needs and service coordination strategies. Additionally, public feedback will be elicited during the 30-day public review and comment period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit system and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I'd now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the Northeast Georgia region. Will?
Great. Thank you so much, Matt. And good morning, everyone. Thank you so much for joining. As Matt mentioned, I just would like to walk you through basically a snapshot of existing transit services and systems in your region. So I'll go through public transit, Department of Human Services, and Department of Community Health. So there are several transit systems that do operate in Northeast Georgia. I'll start first with the urban system, Athens Transit System that serves Clark County with 18 fixed routes, 1 express route, 1 flex route, and paratransit. Next one I want to mention is City of Social Circle that operates rural demand response system within Walton County. Other rural demand response systems include Elbert County, Greene County, Jackson County, and Morgan County. I will note that there are 6 counties that do not have available transit as we know of right now. That'd be Barrow, Jasper, Oconee, Oglethorpe, Madison, and Newton. Next, I'd like to talk about human services and non-emergency medical trips. On this map, we are displaying various agencies that are involved with Department of Human Services on providing those transit services. We have Division of Aging, Division of Family and Children Services, and the Department of Behavioral Health and Developmental Disabilities. There is quite a large coverage across the region. And we will talk about that in a moment as we go through the existing conditions and when I hand it over to Kirsten. Lastly, we have our non-emergency medical trips monitored by DCH, and there are 2 brokers that operate across the state, in 5 different regions. Your region happens to fall within 3 regions. That would be the North region, the East region, and the Central region. Southeast Trans broker operates in North. Mode of Care operates in East and Central. So just take a nice look if you're able to see the screen and kind of digest this. And I'm going to hand it over to Kirsten, and we're going to revisit these maps and see if there's anything that we're missing, any gaps, or any comments. So Kirsten?
Thanks, Will. Yeah, so this is one of our first scheduled breaks. We kind of want to pause here first, see if you have any questions about what Matthew presented on the introduction of Rural and Human Services. And then I have a couple of specific questions for you referencing these maps. So we have a little exercise. If you have access to a computer or a smartphone and you would like to join this poll, you can scan the QR code that is on your screen, or you can visit www.menti.com. That's MENTI.com. Once you get there, it's going to prompt you for a code. The code is up on the screen, and it is 716474. Again, that's 716474. The code will remain at the top of the screen when we get to the questions. If you do not have access to a smartphone or a computer, I will verbally read the questions, and if you would like to raise your hand or put a comment in the comment box, we would love to hear from you. Again, as Matthew mentioned, this is your opportunity to tell us what we're missing or maybe what we have wrong on these maps, but also what your needs are in the region. And we've got a series of questions for you throughout this workshop to kind of get you thinking about what you would like to see come out of this plan. So let's jump into question number 1. I'm going to go back to the maps that Will provided the overview for, but what we want to know is what transportation services are we missing? Are there any counties that we're not showing service that actually have service, or vice versa? Are there any counties where we are showing there is service, but there actually is not service? Additionally, if you know of private transportation services that are being provided that don't receive funding through one of the 3 state agencies, we would like to know that information too. This could be a faith-based organization, perhaps, that is using their own funding to provide transportation services to a group of people. And so you can enter your responses through the Mentimeter, and you can enter as many as you want, and they'll start popping up here. And alternatively, if you'd like to verbally respond, you can raise your hand or use the chat box. So I'm going to go back to these maps, and you should still be able to answer the question. So as far as public transit, as Will mentioned, there are 6 counties that we are showing that do not have any public transit: Newton, Jasper, Barrow, Oconee, Oglethorpe, and Madison. Within Walton County, only the city of Social Circle has transit. And then Clark County has urban transit with the Athens transit system. And then Jackson, Elbert, Morgan, and Greene County all have rural demand response services. On the human services side, we're showing that the entire region is serviced by the Division of Aging, the Division of Family and Children Services, and the Department of Behavioral Health and Developmental Disabilities, with the exception of Jasper County. Jasper County currently does not provide Department of Behavioral Health and Developmental Disability Transportation Services, but it does provide Division of Aging and Division of Family and Children Services. For the non-emergency medical transportation, Will did a good job of covering it. Y'all have 2 brokers covering your region, Southeast Trans and Mode of Care. And what's interesting is that the way that these regions are broken up is you have Southeast Trans kind of dissecting the 2 Mode of Care regions. So while you have 2 brokers, you are in 3 regions. So I'm going to go back, see if we have any comments. We do not. Sounds like y'all feel like we are reflecting the existing transportation service pretty well in your area. So Thank you. Thank you for that. If you do have a comment or you think of something, you can use this entire time to let us know. And again, use the comment box, use the raise hand feature. And we really do want to have some discussion with you guys. My next question. So thinking about the services that exist in your region, what are some of the constraints or challenges that you all are facing, either as a provider or as another service who has customers or patients that are trying to use these services, or maybe as a writer? What are the constraints? And I have a couple examples up here. This could be maybe you want to operate more days of the week. Like maybe you don't operate Saturday and Sunday, but you would like to, or maybe it's time of day. You know, maybe the service stops at 5 or 6 o'clock in the evening, but you're seeing a demand for transportation in those evening and overnight hours. We've heard from other regions who have a lot of industrial manufacturing, distribution and warehousing, that they have a lot of third shift workers that do not have access to transit, for those work trips because of the times of day of service. So we have one response: weekend and longer hours. This has been very common. We've heard this quite a bit, that providers and riders would like to see more days of the week providing service, more hours of the day, especially for that quality of life, to be able to provide trips for everybody and everything that they need to do, not just focus on, let's say, medical trips or trips to senior centers. One constraint that I did hear about in this region, and I don't know if there's anybody on the phone that would like to speak to it, but a couple of months ago, I was having some conversation in this region, and one of the constraints is being able to cross jurisdictional boundaries. And with there being, some counties that do not have services, there may be some activity centers or shopping centers in these counties that people would like to get to, but currently, as it exists now, for example, Clark County, they cannot travel outside of Clark County and go over to Oconee County for any shopping or any activities there. So that's one thing I've heard from this region, are the jurisdictional boundary constraints. What other constraints do you have? What keeps you up at night? Maybe it's on the administrative side. Maybe you're having trouble keeping on top of your national transit database reporting. Maybe one of your constraints is labor shortage or difficulty finding drivers. We've heard that quite a bit across all of the regions. The driver shortage is a major issue. I'm curious if you guys are experiencing the same thing in Northeast Georgia. So these are the kinds of things that we want to hear about. We're hearing about them from other regions. We want to make sure that what your challenges and obstacles are reflected in this process, so that we can come up with solutions. So ultimately, what we're going to do is we're going to take all of this information from these workshops, from the surveys that Barrett's going to talk about, and pull that all together and look at each one individually and come up with some solutions that may alleviate those stresses for you. And also come up with, okay, how are we going to fund this? As Matthew mentioned, it's going to be a series of projects, program, and policy recommendations. So we certainly want to get your input. If you are just now joining us, we are in our first discussion period. I've asked the question, thinking about the existing transportation systems in the Northeast Georgia region, what are some of the constraints that you are facing in the region? Could be days of the week, time of the day. You'd like longer hours, more days of service. And if you are joining us by phone, please feel free to unmute your phone. And if you have any thoughts, you can speak up. Did get another response that driver shortages are also a problem in the Northeast Georgia region. I figured that was the case, but I appreciate the confirmation and providing that input. Okay, again, you're going to have more opportunities throughout this workshop to provide your comments, ask your questions. If you've just joined us, we are in our first discussion break. I'm about to turn it over to Baird to talk about the needs assessment that he and his team have been working on over the past couple of months, and present some of those results. And then we'll have some more opportunities for discussion. So, Baird.
Good morning, everyone. Thank you very much for your time today. We're excited to be sharing some of our preliminary findings for our quantitative and qualitative assessments for the needs assessment. So to start, we want to kind of set up the needs assessment by saying that the needs assessment used for the Rural and Human Services Transportation Plan update is consistent with the needs assessment that GDOT used for its statewide transit plan in 2019 and 2020. This consistency will allow us to compare the outcomes of the two studies and identify lessons learned and help set up our recommendations. Additionally, both the methodologies are taken from a recommended approach produced by the Transit Cooperative Research Program, which is a national research center for the transportation sector. And so they have recommended this approach as a kind of go-to strategy for estimating transit demand, specifically in rural areas. So we're pleased to be using this methodology. It's robust, it's reliable, it's something we put a lot of stock in. Next slide, please. So the way this methodology is conducted is through kind of two main analyses: a non-program demand assessment, which is highlighted here in blue in this table, and mobility gap demand assessment, which is highlighted in green in this table. These two approaches represent an effort to identify transit demand at the county level throughout the entire region, and then use that estimate to produce an estimate of costs. So we'll walk through the table together. But first, we'll start by explaining where the data in these two demand assessments come from. They're both based on demographic profiles at the county level that we then aggregate to the regional level, and specifically looking at demographics of transit-dependent or transit-reliant populations. So for the non-program demand assessment, this focuses on people ages 60 and older, people with disabilities, and residents of zero vehicle households, by which we mean people who live in households where they lack regular and consistent access to a private vehicle. The mobility gap demand assessment takes a similar approach, looking at, but focuses on a specific demographic, and then uses a kind of comparative analysis of travel behavior to estimate trip demand. So with the mobility gap demand assessment, the assessment focuses on the difference in trips taken between one vehicle households and zero vehicle households. So again, that's the difference in travel demand between people who live in households where they do not have ready access to a vehicle and people who live in households where they do have ready access to a vehicle. So it's kind of a comparison among neighbors, essentially based on, again, that access to a vehicle. You'll see that the base year for this analysis is 2019. That's because the data that we're using for this, the demographic data, is taken from the American Community Survey, which is produced by the U.S. Census Bureau. The American Community Survey is issued or conducted on an annual basis, but because certain procedures have to be undertaken to clean the data, to prepare it and make it ready for public consumption, there's essentially a lag in when that data from the survey year gets released. And so the 2019 data represents the most recent set of data that was available to us at the beginning of this analysis. We also use a projection or horizon year of 2050 to estimate how transit demand will change over time. We use 2050 as a horizon year because that kind of represents a consistent number of years projected into the future. It's consistent with the horizon year that was also used in the GDOT statewide transit plan. And to estimate demand in 2050, we use population projections at the county level that are produced by the Georgia Governor's Office of Planning and Budget, which has projections, again, at the county level for population change, leading all the way through 2065. So we also use that 2019 data to be consistent, sorry, got ahead of myself. The 2019 data taken from the ACS is then aligned with 2019 data from transit agencies that were submitted as part of their National Transit Database reporting in order to have a consistent year-to-year comparison. So what we have here is the total number of rural transit trips that were provided by all rural transit providers in 2019. That was totaled to be about 72,000. That's then compared against the aggregate estimated rural transit trip demand for all counties within the Northeast Georgia region, which under the non-program demand assessment was estimated to be 198,000 trips, and under the mobility gap demand assessment was estimated to be about 634,000 trips. This means that there was an unmet rural transit trip demand of anywhere from 126,000 under the non-program demand assessment, all the way to 562,000 trips under the mobility gap demand assessment. And I'm sorry, I should have clarified, the non-program demand assessment and the mobility gap demand assessment are used because they produce a kind of minimum and maximum range for estimating demand. It's helpful for us to have that kind of spectrum of demand in order to be able to make these projections. In order to meet that estimated rural transit trip demand, we calculate the total annual costs associated with doing so, the capital and operating costs. And what we get is to fill 100% of that estimated rural transit trip demand, we have an annual cost of $3.8 million under the non-program demand assessment and $12.7 million under the mobility gap demand assessment. Now that number may seem like a lot, and that's by design. This is a maximalist approach to meeting 100% of the rural transit trip demand. And it's only an estimate. It's not a recommendation or a number that we will be working with as a kind of expected outcome. Instead, it helps us understand what amount of resources would be necessary to meet all identified or estimated demand within the region. So again, not a recommendation, just kind of setting a ground floor. For 2050, we again project transit demand throughout the entire region using those population projections. And what we see is pretty dramatic growth in rural transit trip demand, where the estimated rural transit trip demand nearly doubles under both the non-program demand assessment and the mobility gap demand assessment, increasing from 198,000 to 332,000, and increasing from 634,000 to just under 1.2 million. So again, we're seeing a pretty robust environment for transit service in this region. As a result, the total annual costs to meet 100% of that estimated rural transit trip demand likewise increases from 3.8 million to 6.6 million under the non-program demand, and increases from 12.7 million to 23.9 million under the mobility gap demand assessment. We'll move on to the next slide to discuss some patterns of commuter transit demand assessment, which essentially rounds out the quantitative assessment here. The commuter transit demand assessment is structured a little differently from the previous two types of demand that we discussed earlier. because those previous types of demand focused on transit demand generated within a county for all types of transit trips. So not only getting to work, but also getting to a doctor's appointment, going to the grocery store, doing, going shopping, running errands, etc. The commuter transit demand assessment takes a slightly different approach by focusing on inter-county travel demand, essentially recognizing the economic relationships between counties, where one county may be more of a residential community and another county may have more of an economic center of activity. And as a result, you get travel flows between those counties of people going from their home to their work. This transit demand assessment is based on a proxy estimate of transit demand. Specifically, we're looking at the number of home-based work trips as an approximate estimate for commuter transit demand. The reason we use home-based work trips is that these represent work trips that are not currently being met by another type of transportation mode or transportation service. And as a result, it kind of stands in for transit. Essentially, you could conceive of it as someone who, currently works from home because their commute is too long or too arduous. But if transit service into the community where they work were to become available, they might take that transit service. Now, one thing we want to state up front is that we recognize every county has those kinds of economic relationships. Every county is going to have some degree of cross-county travel, but we set a minimum threshold value of 100,000 trips per year for those commuter transit demand assessments, because that is seen as kind of the minimum value that is necessary to justify and address the capital and operating costs associated with commuter transit. So what we see is that there are several different patterns of commute going both within Northeast Georgia and even crossing into the Atlanta Regional Commission, again, recognizing the Atlanta metropolitan area as a kind of major economic hub for not only for really the region, but for the state. So we have travel from Barrow County into Gwinnett, Newton into Rockdale, Oconee into Clark, Walton into Gwinnett, and Newton into DeKalb. And what we see is that there's variation in transit demand across these different counties, ranging from about 158,000 trips from the Newton to DeKalb corridor, all the way up to 488,000 for Barrow into Gwinnett. And looking into 2050, we see growth in all of these areas, ranging from anywhere from about 2/3 increase to nearly doubling. So what we see is a pretty robust environment for transit demand. And I'm sorry, I should have specified when I talked about the home-based work trips. The data sources used for this are a little different from the ones used in the previous slide as well. It's a combination of information taken from another U.S. Census database and the GDOT travel demand model, which is a tool that GDOT uses throughout the state to estimate travel behavior and analyze potential travel demand. So it's a combination of different sources, but again, ones that are consistent with the statewide transit plan. So again, they show an overall pretty robust level of demand. And I believe we have some additional trips on the next slide. Again, just showing the overall robust level of demand. We have additional corridors connecting Madison to Clark County, Newton to Fulton, Jackson to Hall, and Jackson to Gwinnett. And once again, this is showing travel not only within the Northeast Georgia region, but going from the Northeast Georgia region into the Atlanta Regional Commission area. And once again, we're dealing with pretty robust transit demand. We do have a few corridors here that in 2019 are slightly below that 100,000 trip threshold, but because they exceed that in 2050, as demand increases within the region, we did want to flag them here because they represent corridors that, you know, are kind of on the threshold, but may merit the investment now to kind of capture that travel demand at a later basis. But again, these are not recommendations. These are just helping us understand the kind of current environment for transit demand. I will pause there for a minute before we go on to the qualitative analysis. I just want to see if there are any questions, any feedback, any need for clarification on the quantitative assessment.
Yeah, we can go back to slides if you'd like to look at some specific numbers, but just want to make sure that you all feel comfortable with these numbers, that they're kind of in line with the trends and the needs that you feel are reflected in Northeast Georgia. So again, raise your hand. You can use the comment box. We definitely want to hear from you. Yes.
Go ahead, Eva.
Hey guys. Eva Kennedy, I'm the Director of Planning and Government Services at the Regional Commission. So I think these aren't very surprising to me. I think they're pretty spot on. What I would wonder is, you know, there's a lot of development going on within Walton County, Newton County, and Jackson County. Housing, but also employment centers. And then with that, I know that there is a decent amount of new commercial development going on too. So I wonder kind of how we captured that, and maybe, you know, I guess if you're developing transit to serve kind of between them and Gwinnett or them and, you know, Rockdale or whatever, the kind of reverse goes, because I'm wondering if more demand is going to be increasing to travel in and within those counties than exists right now. Just wonder if that's kind of captured here, because it's all, you know, very new, I think, within the last year or two or three, maybe.
If it's from the kind of last 2 years, it might not be captured here since we are dealing with 2019 commuter demand data. What I would say is we can go back and take an additional look at flows between those counties and see how that changes between 2019 and 2050. Because even if it doesn't get to 100,000, you raise an excellent point that if we're talking about like really rapid growth from you know, a relatively low base, even if it's not a volume of trips that necessarily merit the level of investment of a kind of robust commuter transit service, it might be worth flagging those corridors as essentially corridors to monitor for potentially dramatic increases in growth, like you're saying, if you've seen a lot of development in just the past few years.
Yeah, I think that would be good. And I know just Jasper County has expressed a lot of interest, just to get it on you guys' radar. I know Jasper County has expressed a lot of interest in transit, and they are very rural and they do not have, you know, large population, but they are adjacent to the development that's going on around Stanton Springs, and they're involved in that. And then also, of course, the new exciting Rivian project. So just to get Jasper County, Greene County, Morgan County on the radar of interest in probably workforce related transit into Walton and Newton counties.
Mm-hmm. Yeah, so I will say I went back to the non-program and mobility gap demand assessments, and Baird hit on it. So when we project out to 2050, we're using the Governor's Office of Planning and Budget growth estimates for population. And we're seeing a very large increase. We're seeing this region as a whole growing pretty substantially. over the next 30 years. So from that perspective, I think some of what you're talking about is probably captured, but these are great notes to make note of. And I also would just want to hit on the workforce. This this is this is definitely a theme that we're hearing across several regions in the state, is a need for some sort of workforce transportation program or policy, especially for those entering the workforce, and really thinking about providing transportation to young adults or you know, older teenagers that are going through apprenticeships or internships or attending technical colleges, to really provide the opportunity for these employers to open their labor pool a little bit more, and really encourage, you know, these young adults to enter the workforce and have those opportunities. So something we're definitely hearing, and it sounds like it's no different in Northeast Georgia. Y'all are getting a lot of development, a lot of residential, especially given the proximity to both Athens and Atlanta. And you mentioned the Rivian project, which I think is which is really interesting. And then there's another one off of State Route 316 that's in Gwinnett County. But it's a major, you know, innovation medical hub that they have planned over, I think, the next 30 years. So a lot of
Yeah,
growth in this area.
Rowan is
Yes,
coming.
the Rowan.
Yeah, so they're definitely our little city of Auburn is is seeing a lot of new development related to that too. So you're right. Yep.
Excellent. These are great comments. Thank you so much, Eva, for providing that input. Please keep it coming. Enter in the chat box. Keep raising your hand. We're gonna keep moving through the presentation. Baird's gonna turn it over from the quantitative to the qualitative needs assessment, and results that we're hearing from the survey.
All right, thank you. Yeah, so this it shifts to our qualitative assessment, where we're taking a look at the needs and priorities and challenges identified by our stakeholders directly. It's really important for us to kind of have that nuance as we think about the recommendations and strategies that we'll be building. So we'll start with the provider survey, which we've issued to all the rural and human services transportation providers in the state. It's really important for us to get that perspective from the folks who are actually running and administering this service. We've received 36 responses to date, which we're very pleased with. If you've taken the survey already, thank you. If you haven't, we encourage you to do so. It is open through the end of the month. And either way, we encourage you to share it with your peers and your colleagues. What we've seen so far is that slightly fewer than 50% of respondents are able to carry riders to destinations outside jurisdictional boundaries. And nearly 2/3 of respondents have not pursued coordinated human services transportation or regional transit service. This isn't surprising. We recognize that that kind of interregional or intercounty travel represents a significant increase in complexity and administrative burden. And a lot of these agencies are pretty small and may not have the administrative capacity to take on those additional functions. Many agencies reported less ridership in 2020 than in 2019. 6 respondents had fewer than 5,000 trips in 2019, but this has increased to 10 for 2020. Again, this doesn't surprise us, but what we see here are the impacts of COVID-19 on transit ridership and really, the transit sector as a whole. We recognize that in 2020, COVID caused a lot of shutdowns where, people either lost their jobs or, restaurants had closed, doctors weren't seeing non-essential patients, or rather weren't seeing patients for non-essential services. There was a lot of disruption to travel that just, may have meant people weren't traveling as frequently or to as many places. And, tragically, there was also the loss of life associated with COVID-19. So some of these agencies may have just lost some of their ridership base. But what this means is we recognize that transit agencies are kind of starting from the back foot as we put this plan together, and they're still in a recovery mode, still trying to get back to that pre-COVID ridership. And so we're trying to be cognizant of that as we put together our recommendations and strategies. We did ask agencies to indicate what sort of technology they were thinking about adopting or had already adopted. And most interesting to us was that while 2 respondents indicate that they currently use a smartphone app or website for trip planning and fare payment, 8 agencies are considering adopting this tool. So, we might see a kind of sudden increase in the number of tech-enabled or smart transit systems in the coming years, which is really excellent to see. This sort of this effort to make information about the transit trips more readily available to customers and in more ways has definitely unlocked a lot of benefits for them. It's made the service easier to navigate, more accessible. We're glad to see agencies considering this. We asked about the most common state of good repair needs and got a really interesting combination of responses that again seem to address more traditional issues and emerging issues. So the most common need is purchasing new vehicles. Again, the perennial challenge of rural and human service transportation providers, making sure that they are able to, secure the funding and execute those procurements for their new vehicles. But the second highest issue that we heard about was establishing regular maintenance schedules, which some of the comments that we received from providers indicated is due to the fact that these providers share their maintenance staff with other providers in the region or even other county government agencies or municipalities. And as a result, they can't schedule their maintenance when they want to, which may impact their ability to, repair their vehicles, keep them in a state of good repair, and then get them into service, which then in turn may impact their ability to provide that service on a reliable and consistent basis. And this seems to overlap with some additional challenges that we heard related to attracting and retaining qualified personnel. This is, unfortunately, just another outcome of the strange times that we're living in and the impacts of COVID-19 with the workforce disruptions that COVID has had. We recognize that, it's always been competitive to keep drivers, who have their CDL. But what's interesting is we heard in an earlier workshop from some transit providers that said they're no longer competing just with other, transportation providers like limousine companies or trucking companies or things like that. But instead, they're actually competing with fast food restaurants because those fast food restaurants have lost their workforce too and are, have increased their starting wages. So people aren't just, switching from driving companies, they're leaving driving altogether and, are slinging burgers and fries. So we recognize now that transit agencies are really competing with essentially the entire economy to keep their drivers and maintenance staff. The other main administrative challenge, of course, is the perennial challenge of compliance with state and federal reporting. Again, recognizing that these are smaller agencies with small administrative staff, but they still have to produce those FTA reports and still have to contribute to GDOT's transit asset management planning process. So recognizing the administrative burden that they're dealing with. Additional challenges that we heard related to rider demand and satisfaction were expanding service into new markets and ensuring that transit essentially goes to where the customers need to go or want to go, but then also dealing with the public perception of transit, which again kind of speaks to the combination of traditional issues and emerging issues where we recognize, in a lot of these rural communities, people don't see transit as something that they can take. They see it as something set up for the elderly or for people with disabilities. but we really need to ensure that, we're marketing and promoting these services to say, nope, transit can be accessible to all, it can be open to all, and it can play a role in many people's lives. But then, of course, we also have, the impacts of COVID once again, where transit starts to be seen as an unsafe environment where, people may not feel comfortable traveling in an enclosed space next to multiple people. They see it as a health risk. The evidence suggests that this isn't the case, but again, it still speaks to the challenge of the current moment and the need to kind of further tweak those marketing and outreach strategies to, address public health issues as well. Finally, we also heard on funding challenges that the most significant challenge was securing local capital funding, which again, perennial issue. A lot of these rural and human service transportation providers are operating in smaller counties with leaner government operations, and finding the funding for those longer term capital investments can always be a challenge. So we will move on to the rider survey now, and kind of walk through the findings there. Again, the rider survey is still open through the end of the month. We encourage you to share this survey with your constituents. We want as many responses as possible. We have 55 responses to date, which is definitely a good number, but one of the things that kind of immediately catches our eye is that 85% of respondents do not currently ride transit. Obviously, we're happy to hear from people who don't ride transit. I mean, the fact that they are taking the survey anyway, even though it's on a topic that they don't use or engage with all that regularly, means people are still paying attention to these issues, and we're glad to hear from them. We want to know how transit may not be meeting their needs. But obviously, we want to ensure that we are hearing from our riders, because it is critical to ensure that we're meeting their needs as well and continuing to deliver a high quality service. So hopefully we'll get that to closer to a 50-50 split by the end of the survey period. Among those who ride transit, their main reason for riding is that they lack access to a vehicle, and their most common trip purposes are work, medical appointments, and dialysis appointments. So what emerges from that is, a number of time-sensitive trips. People need to get to work on time. People need to get to their doctor's appointments on time. Dialysis appointments are scheduled pretty tightly. So that, we immediately start to see what will become a common theme throughout these responses, which is the need for reliable and consistent service to address these time-sensitive needs. People did indicate, or I'm sorry, transit riders did indicate that if transit were not available and they had to find an alternative, their most common alternative would be to get a ride from a friend or family member. Again, that's very common in rural and human services transportation environments. We recognize that, people are often using a combination of mobility sources in order to meet all their needs. But we recognize that, relying on those social networks can be difficult, it can be complicated, inconsistent, and it creates costs for those friends or family members who now have to provide additional transportation trips. So we want to ensure that, transit is as reliable and as consistent as possible to meet as many of those mobility needs as possible. Among those who do not ride transit, the two most common reasons for not doing so are that they are interested, but transit is not convenient, or unfortunately that they are simply not interested. So again, we see the need for, marketing and outreach that can communicate the value and the impact of transit in people's lives. Among those who do ride transit, their most frequently selected transit for using the service is that the service is not reliable enough for time-sensitive trips. Transit does not go to where they want to go, and the distance to the nearest transit service is too far. So we see some of the tensions there with providing transit, where we hear both the coverage issue of, does transit go to enough places throughout the destination, but then also the reliability issue. Is transit able to complete those trips quickly enough and efficiently enough that people can trust that they'll always be able to get to where they want to go in a timely manner. So it definitely speaks to the challenges of meeting multiple types of service needs. for these rural and human service transportation providers. We also asked respondents to indicate which sort of transit improvements they want to see transit providers prioritize. And what we heard was provide access to jobs, provide access to healthcare, and connect different parts of the community or region together. So again, that same dynamic of expanding coverage while also being reliable enough for those time-sensitive trips. We also asked respondents to indicate which transit technologies they want transit providers to prioritize when making investments in the system. And what we heard was real-time arrival information at transit stops and real-time arrival information available via smartphone, website, or text. So the priority from the riders is having access to more information about when their transit trips are arriving so that they can plan accordingly. Again, this makes perfect sense in the context of these time-sensitive trips where they want to ensure that they are receiving transit service that is consistent, reliable, and that they can set their own schedules accordingly. So that concludes our overview of the results from the rider and employee surveys, rider and provider surveys. Again, we encourage you to take the survey and to share the survey with your constituents, your colleagues, and your peers. Thank you so much.
All right, thanks, Baird. So that concludes the presentation portion of this workshop. We want to use the remainder of the time to just have some discussion about transportation services in the area, talk about some challenges, maybe some opportunities, some things that you're interested in. Maybe we build off of some of the conversation that we were having earlier. We're done with the Mentimeter. I meant to tell you that earlier, that you can close out of that. Now we just want to have discussion based. So again, chat box, raise your hand. We'd love to hear from you. This is your opportunity. We will be taking additional questions and comments via email up until March 4th, which is a week from tomorrow. So we will have Matthew's email address at the end of this where you can contact him or myself. Both of our email addresses will be available. So I'm just going to kind of open it up. I have a series of questions to just kind of get the conversation going. We can talk about whatever you want to talk about, but these were just some ideas. Excuse me. So this is just a reminder about the raise hand and the chat box. So first and foremost, let's think about service areas and connections. Eva, you said that Jasper County has expressed a lot of interest in transit, as has Greene and Morgan counties. There's a lot of development in Walton, Newton, and Jackson counties. So I'm curious, do y'all feel like those are kind of the next areas that you as a region want to focus on expanding transit to, or are there other parts of the region where more service is needed? Are there any connections that you feel are there that are important that we didn't already identify in that commuter transit assessment? Eva.
Go ahead, Eva.
Hey, so Morgan County has a rural transit system. I'm trying to recall if Greene County does. I believe they do too. So I think just from what we've been hearing and speaking with people throughout the region and just kind of what providers are doing, I know Morgan County has started offering rides kind of outside of the county. And that seems to be kind of the growing trend is there seems to be demand more for kind of trips outside of counties, as you guys already touched on. I think that focusing on serving our growing employment hubs, so that's going to be in and around Walton and Newton counties for kind of that area of the region, and then Athens still gonna remain a big employer, and connecting to the Athens, Clark County and the UGA bus systems obviously would be important. And then also over in Jackson County. So connecting, for example, like Madison County and Elbert County over to Jackson County. Elbert County has a rural transit system as well, and I think they're open to kind of expanding and maybe offering connections to ideally like the Athens Clark County system.
So not to keep you on the hook, but I am curious from everybody on the call. So my next series of questions kind of about coordinated service. Have there been conversations among these transit providers to talk about a regional coordinated service to provide more of these interregional trips and cross-county trips?
Yeah, so we had hosted prior to the pandemic, we'd been hosting kind of regular roundtables with the existing transit providers, and then trying to get representatives from communities just kind of interested in transit involved. And there had been some conversation between Elbert and Athens Clark County, although Butch with Athens Clark County retired. He was kind of the long time transit coordinator. So we haven't kind of picked up conversations there again, but I think that there's definitely interest. I think that the main hesitation, at least from my perspective, is, or from, you know, what I think I've been hearing, is that a lot of the transit providers are interested in perhaps a little less responsibility in terms of reporting and that sort of thing, as opposed to kind of taking on more. But there's a lot of interest and recognition of the need to expand and offer service into other areas. I know, for example, Morgan County's transit system, they changed their hours of operation to kind of open those up a little bit and align better with you know, what the workforce might need. And they saw an increase in use through that for sure. And then again, offering those rides kind of outside of Morgan County, they've noticed kind of an increase in use. So even little changes like that, but I think, yeah, really having, as you guys touched on, having just reliable, timely service to where people need to go seems to be key.
And then I want to add really quickly from our chat box, Tasha Lewis says the transportation providers provide cross-county transportation within the region.
Would you say that all of the providers are doing that, or is it just in some cases? I'll give you a minute to respond to that question. Yeah, so you know, talking about, you know, coordinated service, the providers are interested, but they're also very interested in having less responsibility. So I think that's a good point. Like, how can you put together a coordinated system, but also make it where it's efficient and helping the providers reduce some of the responsibility and stress that they have on them.
And while we're waiting for Tasha to respond, Eva, did you have another question, or is your hand just still up?
Sorry.
No problem.
I will comment, and I know Tasha can probably answer this as well, but so they deal with the like aging and handicap related services. So they'll be able to answer better on that part. And then my division just deals with you know, the strictly rural transit providers, not specialized services. And from what I know, at least, I think every single provider does offer service to other destinations, for example, Athens and that sort of thing. But generally, either it's a more limited schedule of those trips, you know, like they're only offered on certain days or something like that. And then definitely more expensive. I wouldn't say prohibitively expensive, but some of them might be if you were doing it to commute, you know?
Yeah.
And Tasha has responded by saying all of the transportation providers.
Okay, well, that's good. It sounds like, at least at the county level, um, there are opportunities for people to take trips across jurisdictions, and that was a challenge that we heard from the survey that Baird talked about. So it sounds like that's less of a challenge. There's still some interest in new service to some of the counties without service, and maybe some interest in a coordinated system. But it really sounds like y'all are focused on workforce. There's a lot of employment centers that are coming in, and the expansion of service. You all really want to focus on providing transportation to employees to get to those employer centers. Yeah.
I swear I'm not trying to take up all the time talking. I just wanted to add to, with the workforce, just another thing we've heard is access to childcare. So people being able to drop their kids off and pick them up on the way to work, convenient. It's just kind of a nuance of that too.
That's a great point. That is not something that has really been brought up when we've talked about the workforce, but I think that's a great point. If they need a ride to get to work and they have children, their children probably need a ride too, especially if, they're not going to a public school, they're too young, or, the public school system doesn't provide bus service to wherever they live. Excellent. So I saw earlier on that the labor shortages are causing some issues in Northeast Georgia too. Are y'all seeing it? Are y'all seeing the labor shortage cause issues with the service that you could provide? Like, are your third-party operators or your providers having to cancel trips on riders? We heard that in some of the other counties, that they're so short on drivers, they are having to cancel trips that are booked. Give you a minute to think about that. Um, the other thing that we've heard from providers is there's a real strain on their vehicles. I think, getting the money to purchase new vehicles is not a new challenge, but I think the added layer of supply chain issues is delaying delivery of vehicles that have been ordered, and also delaying maintenance schedules because car parts, vehicle parts, are also delayed in being delivered. So I'm curious if y'all are experiencing issues or challenges on your equipment or vehicle side too.
Tasha says that this was an issue, but for the most part, it's been resolved. It'd be
I'm
interesting to hear
curious
how
about
it
that.
was
How did you
resolved.
resolve it?
Yeah, that's my question too.
I am not sure how the transportation providers resolve their staffing issues, but they back in the fall it was they had more issues with having to cancel trip or late arrivals, but so far it has not been an issue this year. They've been able to meet all the demand that we send their way. The only time it may be an issue if it's a wheelchair request, due to just being limited amount of wheelchair vehicles to begin with. But we haven't had an issue with appointments being canceled for a while now.
That's great. I think y'all are one of the only regions that that's not one of your top concerns. It seems like that has come up across the state. I'd be really interested to see what changes the providers made from the fall until now to um, cover their drivers. Like, I don't know if they increased their driver wages or provided some additional incentive or fringe benefit. Because I think that's kind of the solution that everybody else is going towards. Like, we just need to pay our drivers more, or we need to offer more fringe benefits. Um, so that they don't keep leaving and going to, you know, other industries. Okay, I've got a last few questions. And again, you don't have to answer all of them. These are just kind of get the juices flowing, get you brainstorming about what your needs are. So this is kind of on other needs, maybe operating or administrative needs. How, I don't know how y'all feel about all of the reporting that has to be done, if that's a major concern. I mean, Eva, I think you mentioned that the providers are certainly interested in less responsibility, and I'm curious if some of the administrative and reporting responsibilities are kind of part of that. And we have heard that in other places that they would really like, you know, a program or some sort of policy in place to either make the reporting easier and more consistent among the different agencies, or have a program where there is reporting support that they can tap into. And, you know, maybe it's not an employee, but maybe they can like use some sort of contract vehicle with one of the state agencies and get additional resources when reporting needs to be done. Those are some suggestions. And kind of last question, kind of the end all be all. If $1 million kind of fell into your lap, how would you spend that money? Where would you prioritize it? This will help us understand a little bit of how we should prioritize recommendations out of this report. So $1 million today, where would you put that money? And it can be from anybody's perspective. It does not have to be, you don't have to be a provider. Just from your perspective, where do you think money should be invested first? I'll let you keep thinking about that and hope that you come up with some ideas. You can put them in the chat box. I am going to turn it back over to Matthew to finish out the slides for us and give you some more information about kind of next steps and how you can connect with us.
Awesome. Thank you so much, Kirsten, and thank you all so much for your comments and discussion today. It's been really, really helpful for us. Again, all these comments will be noted in our meeting summary. And also this meeting is being recorded and will be put on our website as well, along with the slides. So just to review our schedule one more time, we are working on the existing conditions assessment. This information goes into that assessment, so it's been really helpful to hear some of that today. Also the alternative analysis, and we are starting the development of the draft final report in the coming months. We are targeting July for publishing that draft report on our website for that public comment review period. Once again, I want to thank you so much for your participation in today's workshop. Please do not hesitate to reach out to me or to Kirsten with any other questions or comments on the information we shared today. Also, we ask that you please complete the survey if you've not done so, whether you are a provider of RHST services or a provider in those services. We want to hear from you. If you're on the phone, you can find the surveys at www.dot.ga.gov/transit, and my email is mawilson@dot.ga.gov. We do ask that you send any questions or comments by March 4th, so we have time to respond and note them in our summary. So with that, thank you again so much for the time this morning, and have a great afternoon.